Okay, moving on, let's look at the difference between potency and efficacy. So potency is how much drug would I need for it to start working, for it to work. So let's say that I'm in severe pain. If I take 10 milligrams of morphine, is that potent enough? Is that going to produce an effect? And yes, it is. 10 milligrams of morphine is going to work for me. I'm going to feel less pain when I take 10 milligrams of morphine. If I take 10 milligrams of meperidine, is that potent enough for me? And it's not. You can see the X. That means that this is not going to produce an effect. This is not going to make me feel better. But if I take 100 milligrams of meperidine, well, that's going to make me feel better. So 10 milligrams of morphine is potent enough. It's going to produce an effect. And 100 milligrams of meperidine is also potent enough. It's going to produce an effect. Efficacy looks at what's the maximum intensity of effect. What's the maximum amount or intensity of effect or response that can be produced by a drug. So if you look at 10 milligram morphine and you compare it to 100 milligram meperidine, they're the same efficacy. That's the maximum intensity or effect that I will get to treat severe pain. So no more than 100 milligram, no more than 10 milligram. Basically, this amount and this amount has the same effect. It will work just as well to treat severe pain. Now, when you take a drug, there are many drug effects that can happen. So there's the therapeutic effects, and what that refers to is that the drug works. The drug makes you feel better. So if I have a fever and I take Advil or Tylenol, I feel better. That is known as a therapeutic effect. Sometimes you can get adverse drug events, and this is basically when you have an unfavorable response to a drug. And so let's say you overdosed and now you're hospitalized, or you die, or someone experiences death because of an overdose. There could be miscalculations, so the pharmacist miscalculated the amount, and now you had an overdose because they miscalculated it. There could be something called adverse drug reactions, and this is where people could have rash or bleeding in the stomach, drowsiness. So this is like side effects. These are side effects that can happen. Then we have toxic reactions, and toxic reaction is, let's say you take Tylenol and you overused it, so you took too much Tylenol, now your liver is damaged. That's a toxic reaction. So if you take too much Tylenol, it will become toxic. We can have allergy reactions. So as you know, penicillin, 10% of the population, they're allergic to penicillin because it can cause swelling, it can cause itching, it can cause hives, right? That's all because of a penicillin allergy. Lastly, we could have something called an idiosyncratic reaction, which is genetically related. And so there are only a certain type of people that are predisposed to a reaction. So for example, Inuits. Studies show they metabolize drugs really fast. And so they need larger doses of drugs for it to work. So for example, I would need a smaller dose of drug for it to work. But if I were an Inuit, because of my genetically related, let's see how I can word it. Because of a genetic response, I would need a larger dose of drug, because in general, people who are Eskimos or Inuits just metabolize drugs so much more faster. And so that's why they need a larger dose of drugs.